One of the big trends we've seen is the younger crowd, the 20 to 30 somethings that seem to be driving the spread, so to speak. So let's talk a little bit about what trends we're seeing, Dr. C, with these younger patients.
So we're seeing it not just locally, but across the country that young people are increasingly being diagnosed with COVID-19. And the proportion of these younger people with hospitalizations is also on the rise. Compared to March, where there was probably 26% of these people, younger than 40, being diagnosed, hospitalized. At the end of June, those numbers were close to like 40, 45%. So we're seeing that increase, and it's just not here, it's all over the country.
So why does it matter if younger patients get COVID? Because a lot of people think, oh, they're younger, it won't be as bad for them.
Mhm. So here's why it matters. Younger people in their 20s and 30s can still get seriously sick from COVID-19. In addition to that, we think about the foothold or the base that COVID-19 will take. Well, the more people that have it, regardless of their age, means the more people that have it that could potentially infect others, and potentially those that are older and more vulnerable. Right now, while we may be seeing an increase in the numbers, fast forward 2 or 3 weeks from now, where those that are older, those that are more immunocompromised or more vulnerable are infected, then we could be potentially seeing more deaths from these people who are getting it from this group of young people who have it right now.
Is it true that young people are more likely to unknowingly spread the virus?
And we've talked about seeing the fact that, a great majority of the people that are getting sick may be getting it from people who were either pre-symptomatic or didn't have any symptoms at all. Japan, they did one study of a cluster of people and found that nearly 50% of those people that got infected could be traced back to a group of like young people, 20 to 39-year-old young people who've been in bars, who've been at restaurants, who've been at work. And so young people are a potential carrier for these asymptomatic transmissions that could be, that we're seeing right now.
And when it comes to how they do, how they fare with COVID-19, when this
Mhm.
beast of a virus attacks their system, what is
Mhm.
happening with our young people? What are we seeing?
So, as a baseline, we know that young people are less likely to die from COVID-19 than older people, but they can still get seriously ill, and some still will die. When we relate to the types of problems that these people have, we think about inflammation of the heart, inflammation of the lungs. We've heard about these blood clots that relate to this inflammation of the blood vessels that can be present. And let's not forget about we're not exactly sure about the long-term consequences of COVID-19. So what happens 20, 30 years from now, that's still left to be seen.
And what are the bigger implications? I mean, you've kind of indicated there could be things down the road we can't even see in our crystal ball right now. What are the bigger implications for this young 20 to 30 something crowd?
So while they are accounting for more of the hospitalizations that we're seeing right now, think of the resources that they're having to use right now and see what happens in 2 or 3 weeks when potentially those older people or the more vulnerable patients are coming into the hospitals. Will those resources still be available? Will they still be available in those same numbers because we're having to use them on more of the younger patients? So even thinking about how we treat everybody,
Hmm.
moving forward, it's all connected.
Well, we appreciate you joining us, giving us some more insight, Dr. C. Dr. Cedrek McFadden, thank you.
Thank